So this is one of the registry patients that I treated in my office, a fractured central incisor. We put the implant in, engaging that palatal bone with primary stability. So we have that gap. Now this was a 5 millimeter with a 4 millimeter top. We had plenty of room coronally to still have a nice gap space for grafting. And you can see the insertion torque value of 70 Newton centimeters. And again, high ISQ. We do our dual zone graft. Now for the registry, it was an allograft of cancellous bone, as you can see. And this patient was going right over to her restorative dentist for temporary restoration. So we took an impression of the implant and placed, put a suture through just for hemostatic purposes with a healing abutment loosely placed. And this patient hopped in the car with that poured impression with the analog and went to her dentist, who fabricated her restoration temporarily on a model, not in her mouth, which made it much more pleasant for the patient. And you can see at time of delivery of this provisional restoration, it's a little short so it doesn't contact the lower incisors, out of occlusal contact. And you can see at 3 months, we take a new ISQ value and we've stayed very high. So now we feel confident that we can send this patient back to the restorative dentist. And as a periodontist, this is what we love to see. When they unscrew our temporary restorations or their temporary restorations, they have a thick, healthy mucosa surrounding what's going to be the permanent restoration.